Number 10, warm beer and human urine for jaundice. The Ebers Papyrus, that 20-meter long scroll discovered in 1873 by the German Egyptologist George Ebers and now kept under climate-controlled glass at the Leipzig University Library, contains 842 recorded remedies. Most are unremarkable: honey for wounds, onion for coughs, castor oil for constipation. But buried among the 110 pages is a treatment so revolting that modern translators initially assumed they had mistranscribed it. They had not. For diseases of the liver, particularly the yellowing of skin and eyes, that the Egyptians called the disease of the bile, physicians prescribed warm beer mixed with fresh human urine. The patient was to drink this concoction daily, sometimes for weeks at a time, until the yellow tinge faded from his skin. Here is what the Egyptian physician believed. The body was a network of channels modeled on the irrigation canals of the Nile. When the channels became blocked, the body filled with corrupted fluids. The yellow color of jaundice was, in their reasoning, a buildup of foul matter that needed to be flushed out. Beer was understood to be a substance of cleansing. The Egyptians drank it daily, gave it to children, and considered it a gift from the gods. Urine, meanwhile, was thought to contain the body's purifying power, the very substance that the kidneys had judged unfit to keep. Mixing the two created, in their logic, a powerful cleansing agent that would scrub the liver from the inside. FYI, modern medicine has actually confirmed that urine contains urea, which has some mild antibacterial properties, and that fermented beer contains trace amounts of B vitamins beneficial to liver function. But these benefits are vanishingly small. What the patient was actually drinking was a warm cocktail of fermented grain laced with the metabolic waste products his own body had just expelled, including, depending on the donor, traces of ammonia, salts, and any bacterial contamination present in the original specimen. The Ebers Papyrus is explicit about the dosage. 1 hin of beer, roughly half a liter, mixed with a smaller measure of fresh urine, ideally from a young man in good health. The mixture was to be warmed before serving, presumably to make it more palatable, though it's hard to imagine any temperature making this drink palatable to anyone. Patients with actual liver disease, suffering from hepatitis or cirrhosis, would have had their condition catastrophically worsened by the additional toxic load. The urine of a healthy donor contains roughly 30 grams of urea per liter, and a diseased liver, already struggling to process the body's nitrogen waste, would now be forced to process double or triple that amount. Egyptian physicians, watching their jaundiced patients turn from yellow to greenish yellow to gray, concluded that the disease was advancing too rapidly for the cure to keep up. They prescribed more, stronger doses, more frequent doses. The patient, weakened by the disease and now poisoned by the treatment, would slip into hepatic coma and die. The physician, examining the corpse, would record that the case had been beyond saving from the start. And the recipe, validated by its presence in the most respected medical text in the ancient world, would be copied onto the next papyrus and the next for another 1,500 years. The Greeks would adopt it, the Romans would refine it, medieval Arab physicians would write entire treatises building on the Egyptian foundation. And not until the 19th century, when European doctors finally identified the role of the bile duct and the function of bilirubin, would humanity stop drinking its own waste in the hope of curing the very organ that was failing because of it. Number 9. The Shepherd of the Anus. This is not a joke. This is not internet folklore. This is a real documented job title from the Old Kingdom of Egypt, inscribed on actual tomb walls dating to around 2200 BC. In hieroglyphics, it reads Nero Fuit. The most accurate English translation is Shepherd of the Anus, though some Egyptologists prefer Guardian of the Royal Rectum or Herdsman of the Hindquarters. The job was exactly what it sounds like. There was a man, a senior court physician, whose entire professional purpose was to administer enemas to the pharaoh every single day. The most famous holder of this title was a physician named Irenakshit, sometimes spelled Irenakti or Irenakti, who served around 2150 BC during the First Intermediate Period. His tomb at Giza, near the Pyramid of Khufu, lists his medical credentials with the same pride that a modern surgeon might list a Harvard fellowship. He was royal physician to the pharaoh. He was overseer of the mouth, meaning the royal dentist. And, most prestigiously, he was Neru Fuit, the man trusted to insert a golden tube into the most divine rear end in the kingdom and flush it with herbal infusions, oil, or honey water. Why did this happen? The answer begins with a bird. The ibis, sacred to the god Thoth, was observed by Egyptian priests to use its long curved beak to clean out its own anal cavity with water. Egyptian mythology credited Thoth with inventing the enema after one of his ibis avatars demonstrated the technique. From that observation, Egyptian medicine developed an obsessive theory about the importance of rectal cleanliness. Disease they believed originated in the gut. Rotting food, blocked channels, and accumulated waste corrupted the body's fluids. The solution was to flush the system regularly. Herodotus, the Greek historian who visited Egypt around 440 BC, wrote with surprise that Egyptians purged themselves with emetics and clysters 3 days in every month, believing that all diseases proceed from the food a man uses. Diodorus Siculus, writing 400 years later, confirmed the practice. Among commoners, enemas were administered by midwives and lower-ranking physicians. Among nobles, the job was given to a specialist. And, among the pharaoh, the living god on earth, only a man with the highest medical credentials and the most absolute personal trust could be permitted to handle the divine bowels. The instrument was a hollow reed in early dynasties, later upgraded to a golden cannula for royal use. The fluid varied, sometimes plain Nile water, sometimes a mixture of honey and beer, intended to soothe internal inflammation. Sometimes infusions of fenugreek, juniper berries, or castor oil intended to purge the colon of imagined demons. Sometimes the additives were less benign. Recipes called for mixtures including animal fat, ground minerals, and even crushed beetles, all introduced into the rectum of a man considered the earthly incarnation of Horus. The job was inherited. Iron Natchet did not invent the role. He learned it from his predecessor, a physician named Kui, whose own tomb at Saqqara lists the same title. Kui, in turn, had inherited the position from his father. The shepherds of the anus were a hereditary medical dynasty, passing the secrets of royal proctology from son to son for centuries. They were honored, wealthy, and powerful. They sat at the pharaoh's table, they attended the most sacred rituals, and every morning, in the privacy of the royal chambers, they prepared their golden tube and their warm herbal infusion and went to work. The medical consequences were predictable. Daily enemas disrupt the natural balance of intestinal flora, strip away the mucus lining of the colon, and create dependency. Pharaohs who underwent decades of this treatment would have developed chronic bowel dysfunction, vulnerability to infection, and electrolyte imbalances. Some Egyptologists have speculated that the famously short lives of certain pharaohs, particularly those who reigned in advanced old age before declining rapidly, may have been accelerated by the very treatments designed to preserve their divine health. The shepherd of the anus was, in his own way, slowly killing the king he served, and he had no idea. Number 8. Crocodile dung as eye drops. Of all the eye treatments preserved in the Ebers Papyrus, and there are more than 100, one stands out for its sheer audacity. For cataracts, trachoma, and various other ophthalmological complaints, Egyptian physicians prescribed the application of crocodile excrement directly to the eyeball, sometimes mixed with water, sometimes mixed with honey, sometimes mixed with malachite, a copper-bearing green mineral that gave the kohl eyeliner of Egyptian women its distinctive color. The crocodile, sacred to the god Sobek, was considered a creature of immense magical potency. Its tears, its bile, its blood, and, yes, its feces were all thought to carry concentrated divine power. To anoint a diseased eye with crocodile dung was, in Egyptian thinking, to apply the very essence of the Nile's most fearsome predator directly to the source of corruption. Now, here's where the story gets uncomfortable for modern skeptics. There is, buried in the chemistry, a sliver of accidental utility. Crocodile dung is alkaline, similar in pH to certain ancient eye solutions. Some of the bacteria present in fresh crocodile feces produce substances with mild antibacterial properties, and the act of flushing the eye with any liquid, even a foul one, can mechanically remove debris that contributes to infection. FYI. However, these benefits are utterly drowned out by the catastrophic risks. Fresh crocodile dung is teeming with parasitic organisms including bacteria, protozoa, and helminthags. Salmonella is endemic in reptile feces. So is E. coli. So is Cryptosporidium. For choma, the very disease the treatment was supposed to cure is caused by Chlamydia trachomatis, a bacterium that thrives in unsanitary conditions. Treating trachoma with crocodile feces is the medical equivalent of trying to put out a kitchen fire with gasoline. The disease, already entrenched in the conjunctival tissue, would now be joined by a host of opportunistic invaders. The eye would swell, pus would form, the cornea would scar, and the patient, blinded by both the original infection and the supposed cure, would be led by hand through the streets of Memphis, his eyes weeping a yellow-green discharge, his vision permanently destroyed. Modern paleopathologists examining Egyptian mummies have documented widespread evidence of advanced eye disease. The desiccated tissue of mummified eyes shows scarring patterns consistent with chronic infection, corneal damage, and complications that align with exactly the kind of bacterial introduction that crocodile dung therapy would produce. The very treatment intended to save Egyptian eyes was in many cases accelerating their destruction. Egyptian women painted their eyes with kohl daily, a black powder made from galena that did, ironically, have genuine antibacterial properties. The kohl protected them. The doctors hurt them. In the lower classes, who could not afford the more elaborate copper-based eye treatments prescribed by the temple physicians, were often left with the cheapest option of all: a clay pot of fresh dung scraped from the riverbank, where the crocodiles basked, applied to their eyes with a feather or a small wooden stick. The Greeks, when they conquered Egypt under Alexander, were initially horrified by the practice. Then they adopted it. Roman physicians, including Galen himself, recorded crocodile dung eye treatments in their pharmacopoeias well into the 2nd century AD. The treatment outlived the civilization that invented it by 1,000 years. And during all those centuries, while uncounted patients went blind from infections introduced by the cure, no one stopped to ask whether the people prescribing this remedy had ever, even once, actually tested it. Number 7. Fly droppings and ostrich shell for baldness. Egyptian men were vain about their hair. The art of the period shows pharaohs with elaborate wigs, noblemen with carefully oiled curls, and priests with shaved scalps polished to a divine gleam. To go bald in Egypt was to lose status, to be marked as old, weak, or out of favor with the gods. And so, the medical papyri devote considerable space to remedies for hair loss. Some of these prescriptions are merely unpleasant. Hippopotamus fat boiled into a paste. The fat of a male cat blended with the fat of a snake. The leg of a female greyhound sautéed in oil and combined with the hoof of a donkey, then rubbed vigorously into the bald patches. But one prescription stands above all others for sheer revulsion: fly excrement, scraped fresh from the inner walls of temples where flies gathered to feed on offerings, mixed with crushed ostrich eggshell and the fat of a hedgehog, then rubbed into the scalp every day for at least 4 days. Sometimes the prescription called for the application to continue for several weeks. Sometimes it called for the patient to remain unwashed during the treatment, on the theory that water would dilute the magical properties of the mixture. The fly excrement was considered the active ingredient. Flies, in Egyptian symbolism, represented persistence and the ability to thrive in adverse conditions. Their droppings, fresh and dark and clinging to temple walls, were thought to carry the essence of that resilience. By smearing this essence into the scalp, the physician hoped to transfer the fly's tenacity to the patient's hair follicles. The crushed ostrich eggshell, meanwhile, was understood to provide protective covering, like the shell of an unhatched bird, sealing in the medicinal power and shielding the regenerating follicles from harm. Modern dermatology has, of course, established that hair loss is caused primarily by genetics, hormones, and certain medical conditions, none of which respond to fly droppings. What fly droppings do respond to, however, is the introduction of bacteria into broken skin. The Egyptian scalp, scraped raw by the patient's daily rubbing of an abrasive paste containing crushed shell, would have provided a perfect entry point for any pathogen carried by the flies. Staphylococcus, Streptococcus, the eggs of intestinal parasites that flies had picked up from animal manure piles. Patients seeking a remedy for baldness would have ended up with folliculitis at best, scalp abscesses at worst, and in some cases, full systemic infections that progressed from the head downward. There is a particular cruelty to this treatment. The patient already mourning his lost hair would now find that what remained was falling out at an accelerated rate, weakened by the inflammation and infection caused by the cure. The physician, watching this happen, would conclude that the treatment was insufficiently strong and would increase the dosage, more fly droppings, thicker applications, longer durations. By the time the patient finally abandoned the regimen, often after suffering visible scalp damage, his hair loss had become irreversible. Wigs, made from human hair or sheep's wool dyed black, were the only honest solution Egyptian medicine ever produced for baldness, and the wig makers of Egypt did a roaring trade. Number 6, cat fat and Ibex testicles for impotence. The Kanhun gynecological papyrus, discovered in 1889 by the British Egyptologist Sir William Flinders Petrie and now housed at the Petrie Museum of Egyptian Archaeology in London, is the oldest known medical text in human history. It dates to around 1825 BC, during the reign of Amenemhat II of the 12th dynasty. It is older than the Bible, older than the Iliad, older than the founding of Rome by more than 1,000 years. And among the 34 sections of this remarkable document, primarily devoted to women's health, there is also a section dealing with the most universal of male anxieties, the failure of male sexual function. The recipe is straightforward in its ingredients and disgusting in its execution. Take the rendered fat of a domestic cat, ideally a male cat in his prime, killed and skinned within the day. Take the testicles of a young ibex, the wild mountain goat that inhabited the Sinai and the eastern desert. Crush the testicles into a paste, mix the paste with the warm cat fat, add fresh beer, drink the resulting mixture warm on an empty stomach before the sun rises. The Egyptian rationale was the doctrine of correspondence. By consuming the sexual organs of a famously virile animal, the man would absorb that animal's potency. The ibex, with its enormous curved horns and its reputation for fierce mountain combat over breeding rights, was considered the embodiment of male sexual vigor. Its testicles, freshly harvested, were believed to carry concentrated reproductive force. The cat, sacred to the goddess Bastet, was associated with sensuality and fertility. Egyptian cats were famously prolific breeders, producing multiple litters a year, and the male cat's reputation for aggressive territorial mating made him a natural source of supplementary virility. Mixed together and consumed warm, the cat fat and ibex testicle paste was thought to restore lost masculine power to even the most hopeless cases. What actually happened, of course, was very different. Raw animal testicles contain a small amount of testosterone, but the hormone is rapidly broken down in the digestive tract and absorbed in such trace quantities that no physiological effect would result from consumption. The cat fat, rendered and warm, would have provided calories and saturated fat, but nothing else of value. The beer might have provided a mild psychoactive effect, lowering inhibition and possibly assisting with performance through relaxation. But the placebo effect, far more than any chemical action, would have done the actual work. Men who believed the cure would restore them often did, briefly, experience improvement. They reported their successes to the physician. The physician recorded them in his papyrus. The papyrus was copied and disseminated, and the recipe traveled across the Mediterranean to become a foundational text in Greek, Roman, and medieval Arab pharmacology. The men for whom the cure did not work, and there must have been many, were told to repeat the dose, to extend the treatment, or to combine it with prayers to Min, the Egyptian god of male fertility. Domestic cats, sacred to Bastet and revered as living incarnations of the goddess, were nevertheless killed in significant numbers for medical purposes. The contradiction was apparently invisible to Egyptian physicians, who saw no theological problem with sacrificing one sacred animal to fix a problem in another sacred body. Ibex were hunted in the eastern desert specifically for the medical trade, their testicles harvested and either used fresh or dried and powdered for transport to the cities of the Nile. The Kahun Papyrus does not record how many men were treated with this remedy. It does not record how many were cured. It only records the recipe in clear hieratic script written nearly 4,000 years ago by a physician who genuinely believed he had found the secret to restoring male power. Number 5. The split Hoopoe heart on the chest of the dying. The Hoopoe is a small crested bird found across Egypt and the Levant, with distinctive black and white striped wings and a fan-shaped crown of feathers. In Egyptian iconography, it appears in tomb paintings as a symbol of gratitude and filial piety. The Arabs called it the doctor because of the bird's reputed medicinal properties. And in the Egyptian medical tradition, the Hoopoe occupied a special place reserved for the most desperate cases, for chest pain, for palpitations, for the cluster of symptoms we would today recognize as angina, heart attack, or congestive heart failure. Egyptian physicians prescribed the most direct treatment imaginable. They cut it open from throat to belly while it was still alive. And they bound the bleeding, twitching body of the bird directly against the chest of the dying patient. The reasoning was based on the Egyptian concept of the heart as the center of all life and spirit. The patient's failing heart needed to be revitalized by an infusion of fresh living force. And what could be more alive than a wild bird, freshly cut open, its small heart still beating against the larger, weaker heart it was meant to heal? The bird's body warmth, its lingering spirit, and the magical correspondence between its rapid pulse and the patient's struggling one were all thought to flow into the failing organ beneath. The Hoopoe was tied in place with linen bandages. The patient lay still for hours, and the bird, suffering from a wound that no creature could survive, would slowly die against the chest of the man it was meant to save. Sometimes, the physicians would replace it with a fresh Hoopoe. Sometimes, 2 or 3 birds were used in succession over the course of a single treatment. The blood of the bird would soak through the bandages and dry against the patient's skin. The body, when finally removed, would leave behind feathers, viscera, and the unmistakable stench of decomposition. Modern cardiology has, of course, identified the actual causes of chest pain and heart failure: coronary artery disease, myocardial infarction, cardiomyopathy, none of which respond to the application of a dying bird. What the Hoopoe treatment actually did was add infection risk to an already terminal patient. The open wound of the bird, pressed against the often bare chest of the patient, introduced bacteria and parasites into broken skin, including any scratches or punctures caused by the bird's struggling and the bandaging process. Patients who might have survived a mild cardiac episode were instead carried off by septicemia introduced by the cure. The Hoopoe survived as a medical animal long after the Egyptian civilization that first elevated it to this strange status. Pliny the Elder wrote about Hoopoe-based remedies in the 1st century AD. The Syriac Book of Medicine, compiled around the 9th century, listed multiple uses for Hoopoe parts. The Pharmacopoeia Universalis of 1752, an English medical text, still recorded the virtues of dried Hoopoe brain. Even today, in remote parts of the Sahara, nomads occasionally use parts of the Hoopoe in traditional remedies, a survival of beliefs that began in Egypt more than 3,000 years ago. The bird itself paid the highest price. Egyptian medical demand, combined with the bird's striking appearance, made it a frequent target for hunters and trappers. Modern conservation biologists, examining tomb paintings and offering lists, have estimated that hundreds of thousands of Hoopoes were captured and killed in Egypt over the dynastic period. Almost none of them saved the patients they were sacrificed for. The dying men of Egypt. Their failing hearts pressed against the cooling bodies of dead birds, slipped away just as they would have without the treatment. And the physicians, recording their losses in the temple archives, concluded that the cure had been insufficient and that future patients would require larger or fresher birds. Number 4, placenta smeared on the newborn's mouth. The moment of birth in ancient Egypt was a moment of supernatural danger. Egyptian belief held that newborn infants were vulnerable to a host of malevolent spirits, including a particularly feared entity called the cry demon. This demon was thought to enter the body of the newborn through its open mouth as the child drew its first breath, settling into the throat and causing the colicky, inconsolable crying that all parents know. To prevent the cry demon from entering, Egyptian midwives developed a specific ritual. As soon as the placenta was delivered, the still warm afterbirth was scooped up from between the mother's legs, and a portion of it was smeared directly onto the lips and into the mouth of the newborn child. The afterbirth was considered, in Egyptian belief, to be the spiritual twin of the child. Each baby had a placenta double, called the Ka image, which had grown alongside the baby in the womb and which retained the protective power of the prenatal environment. By smearing the placenta onto the baby's mouth, the midwife sealed the entry point against demonic invasion. The placenta of certain pharaohs was preserved and buried separately, even worshipped as a sacred relic. For ordinary infants, the smearing was a one-time application performed in the first minutes of life. Then the placenta was disposed of, sometimes buried beneath the family threshold, sometimes burned, sometimes given to the dogs. FYI, the practice of placental application is not unique to Egypt. Many ancient cultures developed similar rituals, often based on similar beliefs about the spiritual connection between the afterbirth and the newborn, but the Egyptian practice was the most thoroughly documented, the most ritually standardized, and the most widely practiced. Every midwife in Egypt was trained in the technique. Every newborn in the kingdom was at some level exposed to it. The medical consequences are staggering when viewed through a modern lens. The human placenta is not, contrary to certain modern wellness fads, a sterile organ. It is a highly vascularized tissue rich in blood, including any pathogens present in the mother's circulation. Placental tissue can carry hepatitis B, group B streptococcus, listeria, and a host of other bacterial and viral agents. The mouth of a newborn, with its delicate mucous membranes and its complete lack of established immune defenses, is one of the most vulnerable entry points in the entire human body. Smearing maternal blood and tissue directly onto a baby's lips and into its mouth is, in modern terms, equivalent to deliberately inoculating an immunocompromised patient with whatever pathogens happen to be present in fresh, unscreened blood. Egyptian infant mortality was catastrophic by modern standards. Estimates from the analysis of cemetery populations and surviving demographic records suggest that something between 30 and 50% of all Egyptian babies died before their first birthday. Many of these deaths were caused by malnutrition, parasites, and the diseases endemic to the Nile Valley. But a significant portion, scholars now believe, can be attributed to neonatal infections introduced in the first hours of life by the very rituals intended to protect the child. Tetanus, in particular, was a leading killer of Egyptian newborns. The bacterium Clostridium tetani is found in soil and animal feces, and the conditions of an Egyptian birth, often performed on the floor of a mud brick home in the presence of livestock, created abundant opportunities for the spores to enter the umbilical stump, or the freshly contaminated mouth. The cry demon, in retrospect, was not a supernatural entity. It was the symptom of a bacterial infection that the cure had introduced. And the mothers of Egypt, watching their babies stiffen and arch and stop breathing in the second week of life, attributed the death to the demon's victory over the protective placenta, when in fact the demon and the protection had been one and the same. Number 3. Trepination, the drilling of holes into living skulls. The Czech anthropologist Ales Erdlichka, in the early 20th century, made a discovery in an Egyptian cemetery that initially nobody believed: a skull with a perfectly circular hole drilled into the parietal bone. Not a wound from combat, not a post-mortem ritual. The bone around the hole showed clear signs of healing, with new tissue growth visible at the margins. The patient, whoever they were, had been drilled while alive, had survived the operation and had lived for years afterward. The Qasr Al-Aini Museum of Medicine in Cairo today preserves 3 such skulls, all from the pharaonic period, all showing the unmistakable signs of trepination performed by a skilled surgeon and survived by the patient. Trepination, the deliberate drilling or scraping of a hole into the human skull, is the oldest documented surgical procedure in human history. Evidence of the practice goes back to the Neolithic period, with examples found in France, Peru, China, and across the Mediterranean. The Egyptians, however, refined it. Using copper drills, copper saws, and obsidian blades, Egyptian surgeons could create neat circular openings in the skull of a conscious patient. The reasons varied. Sometimes the patient suffered from chronic headaches that no other treatment had relieved. Sometimes the patient experienced seizures, which Egyptian medicine attributed to wind demons trapped inside the skull. Sometimes the patient had suffered a traumatic head injury that left visible swelling beneath the bone, and the surgeon believed that releasing the pressure would save the patient's life. Whatever the diagnosis, the procedure was the same. The patient was bound to a stone slab. The scalp was cut and peeled back. A copper drill, sometimes as simple as a sharpened rotating shaft, sometimes a more sophisticated instrument with a circular saw blade tip, was applied to the exposed bone. And then the surgeon turned the drill, slowly, carefully, sometimes for hours, until a circular plug of bone could be removed from the skull. The patient was awake for all of it. There was no anesthesia in Egyptian medicine. The Egyptians knew about opium, and there is some evidence that opium was used for pain relief in certain contexts, but its use during trepination is not clearly documented. What we do know is that patients survived. The healed margins of recovered skulls prove it. Some skulls show evidence of multiple trepinations, suggesting that the procedure was sometimes repeated on the same patient over months or years. Some show partial trepinations, where the surgeon stopped midway through, perhaps because the patient died on the operating table, or perhaps because the desired effect was achieved before the bone was fully penetrated. The pain must have been beyond modern imagination. The vibration of a copper drill spinning against the human skull is conducted directly to the brain through the bone, producing a sensation that survivors of modern emergency neurosurgery have described as the worst experience of their lives. Egyptian patients underwent this sensation for hours, fully conscious, bound to a slab in a temple courtyard, while a surgeon they could not see worked above them. Some of them lived. The healed bone proves it. They went on to walk, to eat, to work, to live, for years with a hole in their head covered only by scar tissue and a layer of skin. Whether the trepination actually relieved their headaches or their seizures is unknown. Whether it ever cured anyone is unknown. What is known is that Egyptian doctors believed in the technique strongly enough to perform it for at least 2,000 years, that the bronze tools used were sophisticated enough to allow survival, and that the patients themselves apparently agreed to a procedure that no modern person would consent to without massive anesthetic intervention. The skulls in the Qasr Al-Aini Museum bear silent witness to a level of pain endurance that the modern world cannot comprehend. Number 2. Crocodile dung as contraception. We return to the crocodile and to its remarkably versatile feces. The Kanhun Gynecological Papyrus, the oldest medical text in the world, contains in its 3rd column, 6th line, the world's first documented contraceptive prescription. The recipe is brief and explicit. To prevent a woman from becoming pregnant, take crocodile dung. Mix it with fermented dough, form the mixture into a paste, insert the paste into the vagina before intercourse. The Egyptian rationale, again, drew on the spiritual symbolism of the crocodile, a creature associated in their cosmology with infertility, hostile water, and the dangerous forces of the Nile. By introducing the essence of the crocodile into the woman's reproductive tract, the physician hoped to create a hostile environment in which conception could not occur. The fermented dough, meanwhile, was thought to provide a physical barrier, plugging the entrance to the womb and absorbing any seminal fluid that might attempt to pass. The horrifying part, and you may want to brace yourself, is that the recipe actually worked, sometimes, partially, by mechanisms the Egyptians did not understand. Crocodile dung has an alkaline pH. Sperm, which thrives in slightly alkaline conditions inside the female reproductive tract, can paradoxically be damaged by exposure to very strong alkaline substances. The fermented dough, meanwhile, contained lactic acid, which has actual spermicidal properties and is still used in some modern contraceptive jellies today. The combination of an alkaline plug and an acidic medium could plausibly have reduced the rate of conception by perhaps 30 or 40%, compared to no contraception at all. The Egyptians, observing this partial success, concluded that they had discovered the secret of birth control and refined the recipe across multiple papyri. The Ebers Papyrus, written 300 years after Kahun, recommended a more elaborate version involving acacia leaves, dates, and honey applied to wool fibers. Modern analysis of acacia confirms that it contains gum arabic, which when fermented produces lactic acid, a real spermicide. So the Egyptians were partially right, by accident. The lethal part of the equation, however, was the infection risk. Crocodile dung is not sterile. It contains, as we have already discussed, a host of bacteria, parasites, and protozoa. Introducing this material into the vagina, an organ with delicate mucous membranes, and a direct connection to the uterus was an open invitation to massive pelvic infection. The original infection, called pelvic inflammatory disease, in modern medicine, could ascend through the cervix into the uterus and out through the fallopian tubes into the abdominal cavity, causing peritonitis and frequently death. Women who survived the infections often emerged with scarred fallopian tubes that made them, ironically, permanently infertile. The contraception had worked, but at the cost of their entire reproductive future. Some scholars have suggested that the high rate of female infertility documented in certain Egyptian populations may be linked to the widespread use of dung-based contraceptive pessaries. The very women trying to plan their families were destroying their ability to bear children by inserting fecal matter into their bodies in the belief that it would protect them. The Greek physician Cyrannus of Ephesus, writing in the 2nd century AD, still recommended elephant dung as a contraceptive, having inherited the Egyptian tradition through Hellenistic medical schools. The recipe spread eastward to Persia and India, where it would be adapted and refined for another 1,000 years. Avicenna, the great Arab physician of the 11th century, recorded dung-based contraception in his Canon of Medicine, the most influential medical textbook in the medieval world. Tens of thousands of women across multiple civilizations and multiple centuries inserted animal feces into their bodies on the basis of a 4,000-year-old Egyptian recipe. And the Kahun Gynecological Papyrus, with its careful hieratic script and its calm clinical tone, sits in a glass case in London today as the founding document of obstetric medicine. The smell of the original prescription, mercifully, did not survive the centuries. Number 1. The mouse paste for teething babies. We come, at last, to the worst of them. The most physically revolting, the most morally indefensible, the most directly lethal treatment ever recorded in the medical papyri of ancient Egypt. For infants suffering the pain of teething, those long miserable weeks when the first teeth break through inflamed gums and the baby cries day and night. Egyptian physicians prescribed a remedy involving a freshly killed mouse. The recipe, preserved in the Ebers Papyrus and confirmed by parallel references in the Hearst Medical Papyrus, is specific. The mouse must be alive at the time of preparation. It is killed by a quick blow to the head. It is skinned, with the fur and tail discarded. The carcass, including the bones, the organs, and the partially digested stomach contents, is mashed into a thick paste with a small amount of fresh milk. The paste is then smeared directly onto the gums of the crying child, sometimes pressed deep into the mouth between the cheek and the lower jaw, where the soft tissue would absorb the magical essence of the mouse over the following hours. In some versions of the recipe, the mouse is fed to the baby in small pieces, ground fine enough to be swallowed. In other versions, the mouse is killed by stomping rather than by clean blow, on the theory that the violence of the death added power to the cure. In still other versions, the entire mouse is wrapped in linen and tied around the baby's neck as a pendant, allowing the magical force to penetrate the child gradually through the skin. The reasoning in Egyptian medical theory was based on the mouse's reputation for fierce biting. Mice gnawed through grain stores, through linen, through wooden boxes, through anything they encountered. Their teeth were considered models of dental power. By transferring the mouse's biting essence to the child's mouth, the physician hoped to strengthen the emerging teeth and ease the pain of their eruption. The mouse, in death, would give its dental virtue to the suffering infant. And here is the part that should make you sit very still. Modern archaeologists, examining the desiccated stomach contents of Egyptian infants buried in cemetery sites across the country, have found mouse bones. Actual mouse bones, tiny ribs, vertebrae, and skull fragments found inside the bellies of babies who died in their first year of life. The treatment was not theoretical. It was practiced widely enough that physical evidence of it survives in the burial record. Some of these infants died of teething complications. Some died of unrelated diseases, but many of them died with the cure still inside them, the mouse bone still undigested, the magical mouse spirit having failed to deliver on its promise. The medical consequences of feeding raw mouse to a human infant are catastrophic and predictable. Mice are reservoirs for an enormous range of human pathogens: salmonella, listeria, leptospirosis, toxoplasmosis, hantavirus, the bacteria of bubonic plague in certain populations. The mouth of an infant, with its inflamed gums and its broken mucous membranes from teething, was a wide-open entry point for every pathogen the mouse had been carrying. Babies who received the treatment would develop fevers within hours. They would vomit. They would suffer profuse diarrhea, which in the heat of the Egyptian climate could kill an infant within 24 hours through pure dehydration. The grief of Egyptian mothers, watching their teething babies grow rapidly sicker after receiving the supposed cure, must have been beyond description. The physicians, asked to explain the deaths, would respond that the mouse had not been fresh enough, that the magical correspondence had failed, that the family had angered the gods. They could not identify the actual cause. And the recipe would be copied on to the next papyrus, passed from physician to physician, taught in the temple schools of Heliopolis and Thebes, and applied to the next generation of teething Egyptian infants. For perhaps 3,000 years. FYI. The mouse remedy persisted in folk medicine long after the Egyptian civilization that invented it had collapsed. References to mouse-based cures for childhood ailments appear in medieval European sources, in early modern American folk medicine, and in 19th century pediatric textbooks. The Egyptian temple physicians who first wrote down the recipe could not have imagined how long their idea would live. They could not have imagined that more than 3,000 years after they first dipped their reed pens into ink and set down the words for skin a fresh mouse and mash to paste, their prescription would still be killing children in Appalachian valleys and Russian villages. They could not have imagined that 21st century archaeologists, sifting through the soil of forgotten cemeteries, would find the bones of the mice in the bellies of the babies and would finally piece together the scale of what had been done. The treatment was the worst of them all because it was inflicted on the most vulnerable patients. The babies could not refuse it. They could not run from it. They could not even spit it out, because the paste was pressed deep into their mouths by hands that loved them and meant to save them. They simply lay in their cradles, mouths full of mouse, while the bacteria spread through their tiny bodies, and the cure that was supposed to heal them slowly killed them instead. These were not the practices of a backward people. These were the prescriptions of the most advanced medical civilization the ancient world had ever produced. The men who wrote the Ebers Papyrus, the Cahun Papyrus, and the Edwin Smith Papyrus were the Anthony Fauchus and the Jonas Salks of their era. They had studied at the temple schools of Memphis and Heliopolis. They had inherited a tradition of medical scholarship stretching back to the great Imhotep, the priest-physician of the Third Dynasty whose medical works were so respected that he was deified centuries after his death. They believed, with absolute conviction, that they were saving lives. And yet they were feeding mice to babies, they were dripping crocodile feces into the eyes of trachoma patients, they were smearing fly excrement into the scalps of the bald. They were drilling holes into conscious skulls, binding dying birds to failing hearts, and treating jaundice with warm urine. They were doing all of this while believing themselves to be at the cutting edge of human knowledge. And here is the most uncomfortable thought of all. Somewhere, in the medical practice of our own time, there are surely treatments being prescribed today by serious physicians with impeccable credentials that will appear equally absurd to the historians of the year 5026. We do not know which ones. The Egyptian physicians did not know which of their treatments would be remembered as monstrous either. They simply did the best they could with the framework of knowledge available to them, the same way every generation of healers has done before and since. The Ebers papyrus, the Kuhun papyrus, and the other surviving Egyptian medical texts are not just records of medical error. They are mirrors. They show us what happens when intelligent, well-meaning, deeply trained professionals operate inside a worldview that is fundamentally wrong about how the human body works. The treatments seem ridiculous in retrospect, but the structure of the medicine, the careful diagnosis, the precise dosing, the systematic record keeping, the dedication to the patient's welfare, all of these are present and recognizable. These were doctors. They were just doctors who had not yet learned what doctors needed to know. The mice they fed to babies, the dung they applied to eyes, the birds they cut open against dying chests, all of these were acts of love. Acts of professional dedication, acts of medicine, and the mothers and fathers who watched their children, their husbands, their wives, their parents, suffer and die under these treatments did not blame the doctors, they blamed the gods. They blamed themselves. They blamed the demons. They never imagined that the cure itself might be the cause. We imagine it now only because we live downstream of 3,000 more years of trial and error, of dissection and microscopy, of double-blind studies, and randomized controlled trials. We know what the Egyptians did not know, but we should not feel superior. We should feel, if anything, grateful and a little uneasy. Grateful that we have moved as far as we have. Uneasy that we may not have moved as far as we think.